Hello, and welcome to this foster care online training webinar, Child Development Part 1. I am your host, Dr. John DeGarmo, the founder and director of the Foster Care Institute, and I am a consultant and trainer, and I am a foster and adoptive parent as well. Our goal during this webinar is to increase the awareness of how a child develops. During this seminar, part 1, we will gain knowledge about how a child develops and how to best address each stage in an appropriate fashion. Now, as an adoptive and foster parent myself and biological parent myself, let's just say as a parent myself of over 50 children through my home in 20-some years, you can imagine I have seen various stages of child development in my own home. So this is something that is personal and important to me, just like it is for you. Now, to begin with, the normal development of a child can often pose some very, very difficult times for even the most patient of parents. For those parents who are incredibly patient, normal childhood development can be challenging in its own right, and I'm certain you would probably agree with me as well. Now, as a child moves through each stage of his life, through these different stages of development, each stage comes with its own unique or its own set of developmental tasks. And we will examine these developmental tasks in part 1 and part 2 of this webinar series. Children in foster care, though. Children in foster care may have this normal development that's normal to each child. They may have it disrupted in some fashion, in some way, in some form, due much in part to the very, very significant and specific challenges that children in foster care face from their own personal background, from their own environment, from how they were raised. If you are a foster parent, you will be indeed better equipped to help your child from foster care if you understand the normal development of a child, but in the same time, you're also aware of the risks and potential problems that are often associated with children in foster care as they age from birth to 18 years of age. Now, to be sure, every child, every single child is unique, is special, and is a gift. There is a saying that no two snowflakes are alike. Well, I'm here to tell you that no two children are alike as well. Each child is a unique person unto itself. And because of that, they will develop differently than the next child and the child after that. And all children develop at different speeds and at different rates. One child may be walking at 18 months, while another child may be walking at 1.5 years. One child may be speaking earlier than another child. One child may have better motor skills than a child his same age. Every child is different, and every child develops at a different rate, and that's okay. Generally, there are 4 main categories that every single child will experience in his development. These include the cognitive stage, the emotional stage, the physical, and the social one. Let's examine the cognitive developmental stage first. As a child grows in age, he will experience growth at an intellectual level. His language will increase in terms of vocabulary, the use of his vocabulary, the development of the words he's able to use, as he first learns to speak, as he first learns to recite the alphabet, A, B, C, D, E, F, G, what children often do. And eventually, at some point, he will gain a larger personal vocabulary. He will gain the ability to hold a conversation, and then he will be able to gain writing skills. These are all fall under the cognitive. Emotional stage. Now, trust, as we know, is very, very vital, is essential for a child. In order for a child to progress at a normal rate, it is essential that he learn to trust not just those who care for him, not just his parents or his guardians or his caretakers, but also to trust the environment that surrounds him. He must be able to recognize what is safe and what is not safe, or what might be harmful or dangerous to him. Those who look after him, whether it's his parents, his guardians, or his caretakers, they must be trusting. They must be loving people, individuals, who will teach him and guide him how to properly recognize his feelings and emotions and how to express those feelings and emotions in a healthy fashion. Next, we go on to the physical. As a child grows in size, his ability to crawl, to walk, to run, and to jump, and these are our gross motor skills, will also increase as well. Now, along with this, his ability to work with his hands, cutting with scissors, holding dinner utensils, nice fork and spoons, writing, coloring, hopefully not coloring on your walls, mind you, these fine motor skills, they will increase at the same time. And finally, we go to the social. The development of social skills for children is necessary if the child is to successfully interact with those his age, his peers. Along with that, it is important for the development of social skills if he is going to form a healthy relationship with other people. At the same time, it is also important that the child develop the ability to empathize, to feel with others, understand the needs of other people around him, and to react to those in a positive and a socially acceptable manner. When it comes to children in foster care, though, when it comes to these children who have suffered some type of abuse, neglect, abandonment, whatever it may be, and they're placed into a foster care setting, many of these children exhibit significant behavior problems as compared to those children who come from traditional homes. If you are a foster parent and you have your own biological children, you will notice that the children from foster care may have significant behavioral differences or challenges or problems, if you will, as compared to your own children. Those children, these children in foster care, those children who have experienced this abuse, this neglect, or this trauma, some type of trauma in their life, they're more likely to be delayed in development, or they may even regress to a younger age, a younger stage, if you will, due to the stress, due to the anxieties that they suffer from. So many children in foster care also suffer from internalizing their fears, their concerns, their anxieties. Now, this internalizing of these concerns and fears, it causes additional harm as a result. Children in foster care are more likely to fall further and further behind in their development while under foster care supervision, because they're suffering from these anxieties. They're suffering from these fears and concerns. Remember, as we've looked at other webinars before, when children are placed into a foster care home or foster care setting, it is a time of anxiety. And sometimes these children fall further behind in their development due to the anxieties they're facing, they're feeling, they're internalizing because they're placed into a foster care home. Now, when it comes to age and development, generally a child will develop certain skills and abilities as he ages. This first stage of normal development, this baby stage, is between birth and 12 months. During this baby stage, if you will, this normal developmental stage between 0 and 12 months, an infant develops his own pattern of feeding and sleeping. Now, I have had, oh goodness, umpteen babies come through my home, and it is always a grand event. It is always a time of relief when that baby develops his own pattern of sleeping, and I imagine you would agree with me, right? But after a while, a child will develop his own pattern of feeding and his own pattern of sleeping. This is the age where the brain begins to develop through the use of senses, those five senses. Babies often sleep a great deal. It is important, it is essential for normal development for babies to get that sleep. There's often swift growth. Those first 12 months, there is swift growth. By the end of that first year, that little baby is no longer really a tiny little baby. It is also this time where the motor skills begin to develop, and what is so important is a strong attachment to a mother figure. They have to have some sense of bonding with a mother figure during this stage. It is also the stage where babies begin to vocalize. They begin to learn how to vocalize the coos and the ahs, the oohs and the ahs, the gurgles and the giggles. This is important. This is how they are learning to develop their own vocabulary. They enjoy repeating tasks over and over and over. This is the baby that will clap. This is the baby that will giggle. This is the baby that will play with blocks over and over and over again. Not only does a baby love to be held and hugged, it is essential to the well-being, the mental well-being and development of the child to be held and hugged. Babies need to be held and hugged, and they love it. These babies between 0 and 12 months, they require a tremendous amount of love and affection and nurturing by the parent, by the adult, by the caregiver. And at this time, it is often common to see babies simply playing by himself. And that's normal. That's very, very healthy. During this first stage of development, this is the age of life where the first steps of building loving and trusting relationships in the world begin. This is when they need to build a healthy, loving, trusting relationship with not only you, but the entire world around them. The world that surrounds them, the environment that they are in. It must be an environment of trust. They must learn to trust the environment that surrounds them each day. Now, sadly, if a baby should suffer from neglect or suffer from abuse during this very important, and I emphasize the word important, formative time, these effects can indeed last a lifetime. Let me re-emphasize that one more time. If a baby should suffer from abuse or neglect during these first 12 months, during this initial formative years, months, the effects from this can last a lifetime for that child. Foster parents often believe that they can effectively heal the child from his abuse that he suffered at an early age. The truth is different. The truth is this: the effects from neglect and abuse may need a lifetime of healing, and indeed may require a great deal of both medical and psychological attention. This is where trained professionals, trained therapists, trained counselors come in. When taking a foster baby into your home who has suffered from abuse or neglect, it is best that you surround yourself with as much information about these and support as you possibly can do so. You simply will not be able to heal the child by yourself. Just the love that you give the child, and that love can be very healing. Make no mistake, that love is essential and important to the child and does help the child to heal. But for some children, that is not enough. You can, though, provide a healing and nurturing environment for him. An environment that not only is nurturing and healing, but one that he can begin to learn to trust. And this will help him in his early stages of life. It is during this time that he may have a hard time getting to sleep or waking up if he has suffered from abuse, if he has suffered from neglect, if he has suffered trauma. He may be racked. His body may be racked with movement during his sleep as he moves back and forth, as his sleep is a very, very fretful one indeed. Now, some babies suffer from delays in motor skills as well as in speech during this time due to the result of the trauma they suffered. Now, another result of trauma may result in the baby who is quiet or completely non-responsive to you. Still, other babies will seem depressed or withdrawn and will not look you in the eye. You may try and try and try again, but despite your attempts, you simply may be unable to soothe or comfort the baby. Those babies who have suffered from severe neglect or abuse or trauma during these developmental months, it's difficult to comfort them. Still, others will suffer from minimal weight or from height gain. Now, those babies who have suffered from some type of drug-related problem due to the prenatal exposure to drugs or alcohol from their birth mother's pregnancy, these babies may also suffer from prolonged crying, crying that just continues to go on and on and on. They also may be startled very easily. At the same time, those babies may be overly sensitive to lights or to sounds in your home as well. As a foster parent, as one who cares for these children, these babies, it is important for you that you provide consistent physical comfort to this baby suffering from these symptoms. In order for that baby that's been placed in a foster care home, in order for that baby to develop a healthy relationship and a healthy attachment and trust, he will need you to hold him in your arms. He needs you to hug him. He needs you to embrace him. He needs you to provide love and warmth to him. In fact, your foster baby will require a tremendous deal of hugs, kisses, and physical contacts from you. When you do this, by doing so, you will help him to learn how to develop trust. Trust in you and trust in other people. This is essential. For those babies who come to your home who have suffered from this abuse or the trauma or neglect, abandonment, it's very, very important that you speak to him in very, very warm, calm, comforting, pleasant tone with positive words of love, with positive words of encouragement. Just be kind. overly kind, overly loving, overly comforting to that baby. Encourage that baby to be social with you, to interact with you and to others. Look him in the eye and talk to him. Look him in the eye and sing to him. Look him in the eye while you hold him and hug him. Engage him in eye contact. This is important if his other senses are to develop further as well. Find ways for him to use all of his sense of hearing, his sense of sight, his sense of smell, his sense of taste, and his sense of touch. This next stage is the toddler stage, from ages 1 to 5 years of age. It is during this time that not only does the motor skills continue to develop, but the child soon begins to master some of these motor skills at the same time. Now, he may be unsteady in his emotional state. He may throw tantrums for seemingly unnecessary reasons. And if you have had children in your home who are this age, whether they're foster children, your own biological children, then you are probably shaking your head along with me in agreement and saying, I have been there as well. I have seen that as well. Sure. Is it the same time where children learn to play with others? And finally, their attention span will generally increase as well. During this toddler age, between years 1 to 5, children begin to learn how to dress themselves. In fact, you should encourage them to do so. This is the age where they become toilet trained, and they continue to learn through those 5 senses, through this sense of smell and sight and hearing and touch and taste. Children this age, toddlers this age, are also often sensitive to other people's needs, whether their own peers or adult figures. It is often said that toddlers are full of energy as they run and tear through the house or on the playground. Well, indeed, they become very, very active and energetic at this age. And this is the age where curiosities arises. This is when they ask that all important, encompassing question in their life: why? 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 And you can explain till you're blue in the face, and the next question they will ask is, why? That's okay. This is healthy for them. They're often imaginative during this age. They may play with imaginary friends. They may have imaginary superpowers. They may have an imaginary life. They may have an imaginary world they live in. And this is the age where they also begin to become aware of what is right and what is wrong. And they develop an understanding of consequences to their actions. Now, during the toddler age, this is the age normally associated with the terrible twos, so to speak. Although I must admit to you that sometimes I have seen it as the terrible threes at the same time. Now, for many parents, it can be an incredibly trying, exhaustive, and challenging time, as the patience of even the most patient of parents can be tested to the limit. And this is when a parent becomes exhausted during the times of the terrible twos. Now, children in foster care who have been exposed to abuse and neglect in their lives before being placed into a foster home, they may be overly aggressive during this toddler stage. They may answer back to their foster parent with a continuous reply of no, 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 no. There may be yelling and screaming from the child in acts of defiance. They may become physically defiant, kicking and hitting and throwing objects across a room or another person. They may indeed act openly defiant towards you, the foster parent or the caregiver. They may struggle with feelings of hostility towards their own birth parents at this young age. During this toddler stage, he may even turn his aggression upon himself. You may find he is inflicting pain upon himself through the act of hitting, through the act of slapping, pulling of his own hair, or even banging his head. If this should happen, make sure you document this in writing. For children in foster care during this toddler age of development, they have oftentimes great difficulties with forming a healthy attachment with another person if they have suffered from this abuse, from trauma, from neglect. In fact, he will most likely have the trouble distinguishing between you and his birth parents or his biological family members. And as a result, he may often feel withdrawn or distant, or he might cling to a toy or stuffed animal as he struggles to process his feelings, his emotions. During this toddler age, the child may experience strong feelings of insecurity. This insecurity may produce feelings of abandonment whenever you leave his sight. When you walk out of a room, when you close a door, when you go to work, whatever it may be, he may experience feelings of abandonment from you, which may cause him to cling to you tightly whenever you should leave. Whenever you leave a visitation, whenever you leave a doctor's appointment, whenever you leave him at when you're going to a foster care meeting, whatever it may be, when you leave a room, he may cling to you because he's feeling he's being abandoned yet again. In fact, panic. He may experience panic when he is separated from you. Now, bedtime or nap time may also be times where he feels strongly unsettled, indeed causing him to become anxious and have a very difficult time falling asleep. He might also simply refuse to go to sleep due to his feelings of anger and resentment. For children who have suffered abuse or neglect, their cognitive developmental skills might be delayed due to the abuse or neglect they experience. Along with this, their speech pattern and their use of vocabulary may also be delayed. And finally, their maturity level may also be delayed or hindered. And you find the child acts in a very childish or infantile manner. The simple act of eating can also become a burden, a challenge, a difficult time. In fact, he might hoard his food. He might hide his food in his bedroom or his pockets or his clothing or a book bag or under a pillow or under a bookshelf. He might show inappropriate sexual behavior as well during this time if he was previously sexually abused before being placed in your home. So how do you help this stage? How do you help a child in this stage? Well, to begin with, you need to continue to provide consistent nurturing, additional nurturing. Continue to praise him and to love him and to hold him and to nurture him and to care for him and comfort him. If he regresses to a younger age level, an infant level, do not allow him to do so. Instead, encourage him to act his age and congratulate him when he acts like a big boy. Thank you for being a big boy. Thank you for being my little man. Thank you for being my little helper. Find times, find ways, find areas, if you will, that you can compliment him in all aspects. Give him a sense of accomplishment. Give him a sense of achievement and find ways to do so every single day. He needs to hear words of praise from you. Provide a safe environment for him. Allow him. He needs to feel safe. Allow him to feel safe. Ensure your house is childproof and secure, and allow him to have that feeling of safety. Teach him during these toddler years to take care of himself with toilet issues, brushing his teeth, combing his hair, washing himself. Assign him small chores around the house during this age. Ask him to feed the cat or the dog. Ask him to bring the dishes over from the table. Ask him to push the chairs in. Ask him to help fold the clothing. Ask him to maybe take out the garbage. Whatever it may be, find small chores for him to do. Allow him to do it and encourage him and praise him all the time. You might say something like this: "Thank you so much for feeding the cat. I could not have done it without you. Thank you for bringing the dishes over. You did a great job. Oh, the table looks wonderful. Thank you so much for pushing the chairs in. You did a great job." Not only should you assist him during this time in getting dressed, you also need to show him how to dress himself. Exposure to new places, to new experiences, and new people is also a way that he can not only grow, but also heal and form trust as well. Along with this, it is very important that you engage him in activities that allow him to strengthen his motor skills. Give him the opportunity to draw, to color. Give him the opportunities to run outside and climb a swing set. Give him activities outside every single day. Every single day, encourage him in communication. Talk to him. Get down at his level. Look him in the eye. Hold his hand and talk to him. Encourage him to tell you how he is feeling. Encourage him to express his feelings and his emotions honestly and openly with you. And do so by simply listening. Just listen to what he has to say. Put the book down, put the computer down, put the phone down, turn the TV off, turn away from the dirty dishes, and just listen to him. This has been part 1 of child development in the Foster Care Institute online training sessions. We will examine part 2 in another seminar. For more information about this or other foster care related issues, visit the Foster Care Institute. Find me at Twitter at Dr. John DeGarmo or at Facebook at Dr. John DeGarmo, where I'm always posting information that is helpful in all things foster care. And finally, there is my email. Please feel free to email me with questions about this webinar or other concerns as well. You can find out so much more about this in the Foster Parenting Manual. And indeed, we have several books, several resources for you as well. My friend, I want to thank you for not only taking this webinar, I want to thank you if you are a paid member of the Foster Care Institute, and I want to thank you especially for caring for children in need. You truly are changing the world for children who are suffering. For the Foster Care Institute, I'm Dr. John DeGarmo.